This is Health Trail, and thank you so much for making us a part of your day today. Now, any person walking or driving the streets of our country has certainly seen kids and younger people that have made the streets their home. On Health Trail today, we look at the health issues and challenges that these people have to contend with. They are commonly known as street kids. I'm your host, Chama Kalima, and we join our reporter, Kennedy Gondwe, on this trail.
Another death of a street kid, another moment of mourning for all those that were connected to her. The street children phenomenon is an increasing problem in most parts of Zambia. But while society often looks at this class of people as a social menace, they actually have serious health problems which usually go unnoticed and result into death.
This is a burial procession of a former street kid who was taken into care.
She sadly succumbed to tuberculosis and other opportunistic infections which she contracted while she lived on the street.
The rate of infection and reinfection is skyrocketing because mostly now from a bunch of 5 girls, it's either 3 or 4 are positive and 1 is negative and probably in her window period. So it's so devastating, you know, looking at the rate at which we are moving.
It is estimated that by the year 2006, Zambia was home to around 75,000 street children, though new unofficial statistics suggest the figure has more than doubled. Different reasons are attributed to streetism in Zambia. The main ones are poverty, peer pressure, rural-urban migration triggered by the search for a better living, and the declining strength of the extended family systems as a result of death emanating from epidemics such as AIDS. But when these children are on the street, they become social victims of the very communities they hail from, and when they fall ill, they rely on well-wishers to take care of their health needs. This girl, for instance, is HIV positive and has had a relapse of TB because of lack of adherence to medication. She contracted the disease while on the street. She's still a minor, and like the others I interviewed, their identities have been blurred and concealed to protect them from stigma.
Napimisa naspeza positive mwezi mu 2010 njepe napimisa. Mwanga mstreet muja. Mulima chani yosiyana, mawe yosiyana. Sometimes uzapeza ti mwanga tu 6 so especially sima girls life yenzeko difficult mtaoni moja. Uzapeza ti mwagona ma girls mweka kuzabwela ma boys wajakuru bakuru baje. Azambo kyo fyani azakuza kugona nayo kakana kumenya. Ivezo chitira. Yona osunga kano sofuna kumenya kai. Kuvomera. Nibambiri simapenda. Chechini vuta manyingi pa yote yanga ni mendo yani vuta ya baba ni side infect ya change mankwala ya TB.
The girls use their bodies for survival. So only when they sleep around with men, mostly, they make good money. Good, as in probably a child can manage to buy Ishima or even take herself out to bath and buy a few clothes, which are second-hand clothes. So the men from the community, they are married, they have families, they come, they target our girls, okay, and then especially the men that are coming from the community, they actually use the nearby lodges, okay, where you find that they'll pay more to the lodge and pay a very little amount to the girl. We have the taxi drivers, minibus drivers, conductors, minibus conductors. We have the destitutes, the people that come in to sell their products, you know, and they actually live within Soweto. So they target our girls as their clients. So you find that also there are boys that have lived on the street. It's a community on its own. So they sleep around with the same boys and the rest of the men from different walks of life.
Life on the street can indeed be tough.
Munga badi 5 so. Nikudara maningi lavivu karivo kuba ma downtown mamne. Vamini vogona bakazi vamini. Nabona dwala po je mtantamfu ya bakazi. Boda. Stima mvira bwini. Fune kubwedera kumanyuma.
Msifirisi. Na bora. Nwambiri wanafapo. Atuwakana mamuna ka wamuna kulivina vipondo. Kwa wakana wale pia. Mtu nyula bangu. Vovara kungamba, vovara vipapesika family.
Today on Health Tour, we've been trailing the health needs and challenges of street kids. And our health tour doctor, Dr. Manasseh Piri, is here again to help us discuss this issue. Doctor, thank you so much for being part of us again today.
It is such a pleasure, and I'm so glad that in fact you've picked on a subject that the health systems in our country seem to ignore. You know, have you ever wondered what happens to street kids when they die, when they get sick and so on? So it's nice that you've brought this subject up.
Okay, so we can start from there. The health needs and challenges of street kids. We saw in the clip, we looked at HIV and AIDS. And there's clearly nothing that we're doing for them, is there?
Well, perhaps not nothing as such. Perhaps we're not doing enough. In HIV and AIDS in Zambia, we've always had a group of people that we've called most at-risk populations, and these covered prisoners, men who have sex with men, sex workers, the disabled, and street kids was kind of a very small part of that. We are now at a stage where we are redefining these under the guidance of WHO and UNAIDS and calling them key populations. So as we redefine who are the key populations in our country, what are their specific needs in terms of HIV testing, care and support, treatment and so on and so forth, I think that the children who are in our streets should be a huge part of that, because there are many of them.
And what is the impact of this on the disease burden, even outside of that subgroup, if I can call it that?
And that is all the more reason why we need to bring them up. You know, as we've talked before about some of these key populations, is that we don't know whether the virus, HIV to be specific, is coming from the general population into these young children. As we heard in the clip, there are people who are coming from marriages, from business, from traveling, truck drivers, from coming to do market sales and so on and so forth, who are having sex with these children. Now, are they bringing HIV from wherever they come from into those children, or do these children already have HIV, and how much is it spreading amongst themselves, and how is it impacting on the general HIV epidemic in Zambia? All very, very important questions, and until we can address them like you're doing and asking these questions, we can never know.
Indeed, we can never know.
While sexually transmitted infections, skin diseases, and respiratory ailments are some of the common sicknesses among street children, their immunity is also low owing to their poor nutrition.
They get the diseases from the fellow street boys. There are men also that are coming from the communities that are married. They have families, but then they target the girls specifically for one reason: there's no attachment. You pay her off and the relationship, there's no relationship. She won't come back to you. She won't be able to trace you. She won't identify you.
Medical experts admit that treating street children of their ailments is hard, because while some of them come from established homes which they later go back to, others live on the street.
The biggest challenge is definitely follow-up. So if you have a child, for example, a street child who has an STI or who has TB, those are illnesses that require long-term treatment and follow-up. Then they don't come for review. How do you follow them up? Because now in the treatment of HIV, for example, we have a tracing form where you get an address. How do you even get an address? Who do you see? We always have somebody who is like a buddy, a person who you can call if the person doesn't show up for review. Then who do you call? So that's a big challenge, and as a result that also creates resistance, because if somebody doesn't complete their treatment and they get a reinfection, or their strain of the virus or bacteria gets resistance to our treatment, it becomes harder to treat, and it's in the general population now. And obviously these street kids grow up to be adults one day, and they will affect the rest of the population with issues of rape or defilement, and those infections will continue.
And another aspect that I link to this is the nutritional needs of, because, and if you're talking about HIV and AIDS and any other disease, indeed, the nutrition, you can't take away nutrition.
Absolutely, absolutely. I mean, the thing is about these children that you said in the introduction there that we see them and we pass them. Sometimes we throw them half-left pizza, we give them a bit of money and so on. But we don't have in our health systems specific departments even that address this. I was thinking as I was watching the clip that we had mobile hospitals and we have mobile services. But what we tend to do with those services is that we take them from the center, say from Lusaka, and we go to the peri-urban areas and to the rural areas with mobile services. And I think that what we ought to be doing for nutrition, for health, for vaccinations, for everything that we do in public health, that we should have mobile services within the city structures, within the town structures that address the needs of these children. When we talk about follow-up, for example, so a child is found with an STI or found with HIV and they're put on treatment, and we worry about how are we going to follow them up. I think that rather than wait for them to go back to the clinic where they went, to go all the way from the center of Lusaka to Chawama or to Kanyama or to Chipata clinic, it's a long way for a kid who's walking. And his priority is to get money to feed himself for that day. If we had services that come to them, and then they can come, and these services can be linked with providing them at least a meal per day, I think that would go a long way to meeting some of their specific needs.
Indeed. And as we saw in the clip, there's a girl who's had tuberculosis relapse.
Yes.
And it just brings to me the issue of adherence.
Yes.
I mean, who is there? There's no one helping them to, adhere to the treatment.
No, there isn't. Again, because when we look at adherence support and the way that we have structured it, it is based mainly on a family foundation. So when we bring a child from a home to a clinic and that child has TB and they're given treatment, and then there is the directly observed treatment, we give the medicines to you as the mother and say, can you please make sure that she adheres, that you make sure that she takes the medications at the right time and so on. For street kids, no. There used to be services that looked after street kids, at least when I worked on the Copper Belt in Kitwe in private practice. We had NGOs that went and knew these kids by name, by where they slept and so on and so forth, that visited them. And they would be able to provide adherence support from fellow street kids because they knew the clusters. And that is maybe something that we should do. Because these children tend to be at the same spot all the time in their little groups. So if in that group there's somebody they look up to, somebody who can help them remember to take their medications, we should be doing that.
So should we then as a country in our public health efforts and interventions start looking at street children as a special group of people that need specific and tailored health interventions?
Absolutely. As I always say, and my base where I come from is HIV. If we are going to be able to tackle HIV, to get a handle on HIV, as I will say, we need to find these so-called key populations and look at how we can help them with their infections. We can help take prevention services there, take treatment services there, take follow-up services to them. And for me, I think that these children that are in the streets, I don't like to call them street kids. I think they're children who are growing up in the streets for various reasons. They should be a major part of the key population. And we need to do that. You know why? Because these children are growing up without a roof and without the pillars, without the walls of family that support our children as they grow. Their numbers are large. Soon they become adults. Soon they will be bringing up their own children. As we have heard in the clip, some of them are getting pregnant.
Yeah.
How are those children going to be brought up? Unless we can look after this crop, teach them family values as much as we can, give them walls and structures to support them as they grow, we will have generations after generation and more of these children in the streets. And then we have a time bomb on our hands.
Problem.
Yeah.
Thank you very much, Doctor, for
always a pleasure.
Having been on the trail today.
Thank you. My pleasure.
I must admit, this is one of those sombering moments when you see another human being, and a young person at that, having to go through the challenges that these children that are growing up on the streets for various reasons have to go through. But we are glad that Health Trail is here to bring up these issues, and together we can surely find a solution. Thank you so much for being part of this today.
Come